Gloucestershire Health and Care NHS Foundation Trust is a trust that treats people with physical illnesses and mental health conditions and people with a learning disability. So it's got a wide variety of services which span the whole county. We have inpatient services at our community hospitals and our mental health inpatient units, but most of our services are delivered in people's homes or in local clinics. So there's a real variety of services that we offer to people in Gloucestershire.
So I qualified as a nurse 2 years ago. I applied for the job here. So I came to the interview and I loved it. The environment was really friendly and I liked the atmosphere of the ward immediately. I wasn't really sure about what a community hospital was about at that point, in all honesty. I thought, it'd be a mixed bag of things, but in the last sort of 2 years I've learned more than I ever could have imagined.
So I started as a healthcare assistant for the acute trust. I wanted to develop my skills a little bit more, so I ended up moving to the community hospitals. The position came up for a training nurse and associate. I was training for 2 years and now I'm community as a registered nurse and associate.
I came to work for this trust because I wanted to spend more time developing my nursing competences and skills in looking after people in their own homes, and getting them to take responsibility for some of their own health as well. And I think working in the community with OTs, physios, the multidisciplinary team has sort of afforded me that opportunity, and it's really rewarding.
So I'm dual trained, which means I'm a general health nurse and I'm a mental health nurse. And it was several years ago now that I did my mental health training to complement my general nurse training. I love my daily work routine and I enjoy that because there always is variety to my day. I love being with the team that I work with because we're all very positive about what we do. I just love coming to work. It's a job I think that you can get real satisfaction from.
I qualified 6 years ago as a newly qualified nurse, so I came straight to North Cotswolds and I became a ward sister about 2 years ago. You gain a lot of experience very quickly. As a nurse, within sort of the first 6 months, you are learning how to do cannulation, venipuncture, you're in charge of a ward scenario. But I think the main thing is that you have an awful lot of support from the other members of staff, and we're very much a team up here. To progress to a band 6, to a ward sister, you need to show leadership skills and good communication and just work really well as part of a team.
I really do enjoy my job as a staff nurse. It ticks all the boxes to me for job satisfaction. I'm really keen on patient care, compassionate care, and I'm passionate about caring for my patients and looking forward to their recovery. I've never looked back since I qualified 8 years ago.
So school nursing service works with children from when they start school up until 19 years of age, and we're a public health service. It was always something I wanted to do. I did it as a student for part of a placement, and then I went and worked in acute, but knowing that I wanted to come back to work in school nursing.
So I joined the Trust 5 years ago as a newly qualified nurse. The Trust has invested in my training and I've done lots of courses since being here. I've done the preceptorship course, I've done the physical assessment and clinical reasoning course, and the PADRAP, which is a course which will put me onto advanced nurse practitioner pathway.
I'm a staff nurse on an inpatients ward, and we nurse patients who've come in from either the local acute hospitals or the community. It's a very friendly community hospital. It's somewhere that you'll walk down the corridor and people will say hello and they know your name. It's a really satisfying feeling that you work within a team that you've got good communication and a good friendship with.
With it being a health and mental health trust, because we've got access to everything here, actually we can see somebody come in from the acute hospital, we can see them come in really not very well or just about recovering, and we can see them develop from what they were ready to go home, and you can see their personality change, their physical health change. We can help their families, and we can get them to a point where they're able to have the best quality of life that they can possibly have.
One thing we're really keen to do is support people working in this organisation and them developing their careers. So one of the things we promise is that we will do development plans with people working here, and there are always opportunities to train, develop and move on in careers. It's really important to us, and it's something that we know ensures we provide better care but also a great place to work.
So although you're newly qualified, you are sort of encouraged to, find any areas of nursing that you particularly like, whether it's tissue viability or nutrition or end-of-life care. So after my first 12 months, I was asked if I wanted to be an end-of-life link nurse on the ward, which would mean that if anybody, staff or relatives or anything that had any questions regarding end-of-life care, then they would be signposted to myself. And I supported through that by being put on an end-of-life development programme through the Training Development Sister here, which was a 6-month course.
It was the best decision I made coming straight into a community hospital. I was supported by the ward. I was placed with a buddy who was my preceptor on the ward, and I was enrolled onto the preceptorship course, which was really, really good to further my clinical skills.
There are a lot of opportunities if you want to go up to a band 6, so to a ward sister level, going through management, or if you want to go into specialism, so out into the community on district, or any sort of specialism. There's a lot of avenues to explore in any form of nursing.
We have regular one-to-ones with our manager and regular appraisals, setting out an action plan of where we would like our career to go to. It feels like we're really invested in, and it's very satisfying that the leadership is really empowering young and newly qualified nurses into having a strong nursing career.
If you've got a passion to develop, they will support you. If I'm a bit nerdy and I like to learn, so I keep at it. And I have managed to successfully get a place on a development pathway, which I'm very interested in, which will hopefully on completion enable me to be a district nurse.
Working within the community, as I said, they do train you and they do invest in you, so it's taken me 5 years from being a newly qualified to being a training development sister.
The training is open and available. I know the Trust have got a big thing with trying to empower nurses at the moment, so actually we're going for practitioner roles, so all the training is open for that, and if you show that you are willing and you've got the skills to do it, then they will let you go on any training that's available to get you where you need to be to help the patients.
Working here, I've had sort of a mixed bag of things, surgical, medical, all sorts of different experiences that I don't think I would have had in a speciality.
We work as a team, and our goal is for patient care and for our recovery. Safety is there, health and safety is on top, our training is on top with that, and the management team is very supportive.
Just a really, really good caring trust. They're really good for, they're really supportive in all situations. They help with childcare, they're really flexible. It's a really flexible trust actually, it is really nice.
I've lived in Gloucester for 13 years. I love the area, I love the countryside. I love the Keys that is well known to people, that brings people from all over the world to come and see. I also enjoy going to the cathedral. It's cosmopolitan, people are friendly, and we are out to support each other and we look after each other.
We've got areas of the Cotswolds which are outstanding beauty, Forest of Dean, so it's really nice to be able to go out and visit not only the countryside but also then have the city life too.
Bustling areas of cafes, restaurants, activities, lots to be seen, lots to be done. It's all out there.
So the best part about my job is making sure people are able to stay at home where it's safe to do so, and whether that's their wishes and their needs at the time.
This trust certainly will get you up to speed quickly and competently. They want you to succeed, they want you to fly, they want you to be able to give the best care to our patients.
I love my job, I do. There are days where it is incredibly hard, but those days are also incredibly rewarding. The feedback that we get from patients and we get from family, it makes the job worthwhile.
Giving the best care possible to the patients and the people that use our services is right at the heart of what we do. In order to deliver the best care, we need the best possible people working in our organisation. And we're lucky, we've got them. We have a fantastic team here in Gloucestershire, and we're really keen to get more people who think in the same way as us, put the patients first, to join our team.
I think if people were unsure, I think they would, even if they just came for a conversation or a look round, you know, they'd be quite surprised what we do here is, you know, it's quite amazing.
It's just simply fulfilling. That's probably the best way to describe it.
Don't be afraid to take that leap and try something different. Community nursing, this trust has so much to offer.
I really look forward to coming to work. The team is nice. I know I look forward that I'm going to meet my patients and I'm going to deliver care to people who really need it.